Daily sugar habits quietly strain kidneys, which work nonstop filtering blood without complaint today. Fatigue, bloating, and swelling are often early distress signals kidneys cannot verbally express clearly. These organs operate silently, managing fluid balance, electrolytes, and waste removal continuously every day. The danger is you rarely feel kidney damage until most function disappears completely suddenly. Sugar increases hidden workload, forcing kidneys to compensate without pain warnings or early symptoms. Over time, this constant pressure accelerates decline, while symptoms remain deceptively absent for years. Understanding this silent stress reframes sugar reduction as kidney protection, not preference or trend. Your kidneys filter roughly 50 gallons of blood daily, maintaining balance with remarkable precision. High sugar intake forces glomerular hyperfiltration, making these filters work far harder than designed. Each sugar spike increases pressure inside nephrons, the tiny filtering units within kidneys. Over time, this mechanical strain damages delicate structures that cannot regenerate once lost. Nephrons die permanently, reducing total filtering capacity, even though remaining units compensate temporarily. This compensation masks damage, allowing progression without pain or noticeable early warning signs. Sugar-driven hyperfiltration, therefore, accelerates kidney aging silently beneath normal daily functioning. The process resembles overworking an engine beyond limits, while warning lights remain off. By the time symptoms appear, substantial, irreversible filtering loss has already occurred. Sugar pushes kidneys into long-term overdrive, long before any discomfort alerts awareness. Kidney damage progresses quietly because these organs lack pain receptors, signaling early trouble. Symptoms often appear only after approximately 70% of kidney function is already lost. At this stage, fatigue, swelling, and abnormal labs finally surface, drawing medical attention. Chronic high sugar intake strongly correlates with increased risk of long-term kidney disease. Large population studies consistently link sugar consumption with declining filtration rates over time. Once structural damage advances significantly, reversal becomes extremely limited or impossible clinically. Remaining nephrons must overwork, further accelerating decline through compensatory hyperfiltration cycles. This creates a downward spiral that treatment can slow but rarely fully stop. Early lifestyle change matters most before irreversible thresholds are crossed unknowingly. Reducing sugar earlier protects kidney reserve long before symptoms demand urgent intervention. When sugar intake stops, advanced glycation and product formation drops rapidly inside the bloodstream. Blood becomes less inflammatory and less sticky, reducing resistance during kidney filtration processes. This change lowers immediate workload on glomeruli, easing pressure inside delicate filtering structures. Kidneys benefit quietly as blood flows more smoothly without excessive glucose-driven stress. Meanwhile, the brain reacts strongly, producing cravings, irritability, and temporary fatigue sensations. This contrast creates confusion because discomfort increases while internal organ stress decreases simultaneously. Most people misinterpret withdrawal symptoms as harm rather than signs of metabolic adjustment. Internally, kidneys experience relief even as external sensations feel temporarily worse. This mismatch explains why early sugar quitting feels difficult yet remains biologically protective. Understanding this phase prevents relapse, driven by misunderstanding normal short-term adaptation signals. During the first 72 hours, the brain reacts louder than kidneys, healing quietly. Headaches, irritability, and fatigue appear as glucose-dependent neural circuits recalibrate metabolism slowly internally. These symptoms feel urgent, but do not reflect damage occurring within kidney tissue itself. At the same time, filtration pressure drops, reducing strain on nephrons almost immediately overnight. Inflammatory signaling declines, improving blood flow through microscopic filtering structures inside the kidney system. The kidneys respond faster than conscious sensation because they operate below awareness levels continuously. This disconnect between feeling worse and healing better confuses many people during early withdrawal. Understanding this mismatch helps people tolerate discomfort without assuming harm to their kidneys happening. By day 3, cravings begin softening, while kidney stress remains lower than baseline levels. The body is healing internally, even when sensations suggest the opposite temporarily during adaptation. During weeks 1 to 2, sugar removal reshapes kidney control of fluid balance systems. High sugar spikes insulin signaling kidneys to retain sodium and excess water chronically daily. This retention raises blood pressure, causing swelling, tight rings, and morning puffiness around tissues. When sugar stops, insulin falls, allowing kidneys to release sodium more effectively and fluids. Fluid balance normalizes, bloating reduces, and pressure within blood vessels decreases steadily over weeks. Lower sodium retention improves nighttime urination patterns and daytime energy levels for many people. Blood pressure readings often drop modestly as kidney workload becomes more manageable during adaptation. Reduced swelling signals healthier kidney handling of fluids, hormones, and circulation throughout the body. These changes usually emerge without pain, reinforcing why kidneys heal silently during early recovery. By week 2, many notice lighter mornings, fewer headaches, and steadier pressure overall levels. High sugar intake increases calcium excretion into urine, raising crystal formation risk significantly over time. Excess glucose alters urine chemistry, making mineral crystals easier to form and persist. Fructose metabolism raises uric acid further, destabilizing urinary balance inside the kidneys. These changes increase supersaturation, creating ideal conditions for kidney stone development. When sugar intake stops, calcium excretion decreases, and urine composition begins stabilizing. Citrate levels improve, helping inhibit crystal aggregation and stone growth processes. Lower insulin reduces sodium retention, leading to less concentrated urine overall. Diluted urine decreases pressure for minerals to precipitate into painful stones. Studies show measurable urine chemistry improvements within 30 days after sugar reduction. Consistent sugar avoidance maintains protective kidney stone resistance long-term effectively. By week 3, kidney filtration barriers begin showing measurable, structural, and functional improvement markers. Protein leakage into urine often decreases, indicating strengthened glomerular membranes during recovery phase now. Reduced albumin levels on lab tests reflect improved selectivity of kidney filters during healing. Lower filtration stress allows surviving nephrons to operate within safer pressure ranges again consistently. This change represents real repair, not merely symptom improvement or temporary fluctuation during recovery. Doctors use these markers to track early kidney healing before symptoms appear clinically measurable. Improved filtration reduces protein loss, which otherwise accelerates long-term kidney decline rates significantly. Week 3 often confirms sugar reduction delivers tangible internal benefits beyond feelings alone externally. These improvements strengthen kidney reserve, protecting future function against ongoing metabolic stress exposures better. Laboratory confirmation reinforces why early lifestyle changes matter long before disease diagnosis becomes evident. Chronic sugar intake drives oxidative stress and microscopic scarring within delicate kidney tissue structures. This ongoing inflammation narrows blood vessels, reducing oxygen delivery and filtration efficiency inside kidneys. Quitting sugar lowers inflammatory signaling markers like CRP throughout the body system-wide over time. Reduced inflammation protects kidney tissue and surrounding blood vessels from progressive damage over years. Less oxidative stress allows healing processes to stabilize membranes and cellular structures within kidneys. As inflammation drops, circulation improves, supporting efficient filtration and nutrient exchange within renal tissue. These changes often coincide with clearer skin, steadier energy, and fewer headaches during recovery. Systemic inflammation reduction benefits cardiovascular health while easing pressure on kidney function long term. Lower inflammatory burden slows scarring processes that otherwise accelerate chronic kidney disease development progression. Inflammation control becomes a central mechanism, linking sugar reduction to kidney preservation over decades. Diabetes remains the leading cause of kidney failure worldwide, driven largely by chronic sugar exposure. Excess sugar promotes insulin resistance, forcing kidneys to filter higher glucose loads continuously daily. Persistently high blood glucose damages glomeruli, accelerating diabetic nephropathy development over time. Prediabetes already increases kidney stress long before diabetes diagnosis occurs clinically. Quitting sugar improves insulin sensitivity, reducing glucose burden passing through kidney filters. This change slows progression from prediabetes toward full diabetes significantly for many individuals. Lower glucose exposure protects delicate filtration structures from glycation and oxidative injury. Improved insulin response also reduces sodium retention, supporting healthier blood pressure regulation. Addressing sugar early interrupts the most common pathway, leading toward dialysis dependence later. Kidney protection begins upstream by preventing diabetes rather than treating its consequences. Dialysis is portrayed as life-limiting, requiring hours attached to machines weekly for survival. It replaces kidney function imperfectly, leaving patients fatigued, restricted, and medically dependent long-term. Long-term survival statistics remain sobering compared with prevention through earlier lifestyle changes efforts. Many cases leading to dialysis are linked to diabetes driven by excess sugar intake. This outcome is often preventable when sugar reduction occurs before irreversible damage develops fully. Dialysis reality underscores urgency of protecting kidneys long before symptoms demand intervention becomes necessary. Early choices compound, quietly shaping kidney health decades later without dramatic warnings appearing externally. Reducing daily sugar intake represents a powerful preventative decision rather than extreme measure alone. The goal is avoiding dialysis entirely by preserving filtration capacity through simple habits daily. Understanding consequences motivates consistent action, while protection remains achievable and meaningful for most people. 30 days without sugar is enough to produce measurable kidney health improvements. Blood pressure often decreases as sodium retention and fluid overload resolve gradually. Inflammation markers decline, indicating reduced oxidative stress within kidney tissue structures. Urine tests may show improved protein levels, reflecting stronger filtration barrier integrity. Filtration pressure drops, allowing nephrons to operate under safer mechanical conditions consistently. Bloating and swelling reduce as kidneys manage fluids more efficiently throughout days. Energy stabilizes because toxin clearance improves and hormonal balance normalizes slowly. These changes do not represent a cure, but a meaningful physiological turning point. Continuing sugar reduction preserves gains while preventing progression toward chronic kidney disease. 30 days provides proof that kidneys recover when unnecessary sugar stress is removed. Occasional sugar is different from daily excess that quietly strains kidneys over years. Each sugar-free day reduces filtration pressure, protecting nephrons from cumulative mechanical damage. Kidney health is shaped by small, repeated choices, not dramatic symptoms or sudden crises. Every beverage, snack, or dessert represents a decision influencing long-term filtration reserve. Most damage occurs silently long before pain or diagnosis forces attention urgently. Choosing less sugar today preserves options freedom and health decades later. This is not about perfection, but reducing unnecessary daily stress on vital organs. The coffee shop choice dessert habit or evening drink becomes a protective action. Kidneys respond quietly, benefiting from restraint even when cravings argue otherwise. The decision remains simple: protect your kidneys daily or postpone consequences unknowingly.